Dr. Stephen Kupferman, D.M.D., M.D., co-founder and CEO of MedVA, that's MedVA, like virtual assistant, holds his D.M.D. and M.D. degrees from the Harvard School of Dental Medicine and UCLA's David Geffen School of Medicine, respectively. He first pioneered the use of virtual assistants to optimize the management of his 6 oral surgeon practice while simultaneously improving the quality of patient care. He then went on to found MedVA, a healthcare virtual staffing company. They vet the healthcare professionals themselves, mostly of whom are registered nurses in the Philippines, before they hire them, and then they're trained in the MedVA proprietary program to optimize practice management. So we talk about the advantages and disadvantages of hiring a virtual assistant, how he defines a virtual assistant rather than just any pandemic employee who's working from home, and where to start when you're delegating tasks to your first virtual assistant.
Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing Krebs cycle. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of their respective employers. Those on this podcast accept no liability for the outcomes of medical decisions based on this information. As the radiologists like to say, clinical correlation is required. This is not medical advice, and this does not constitute a physician-patient relationship. If you have a medical problem, seek medical attention. And now, here's Dr. Bradley Block.
And now a word from this week's sponsor, Laurel Road.
Taking out med school loans had me watching every penny. I took 2 buses to get to campus. During my residency, I walked 20 blocks. But since I opened a Laurel Road linked checking account when I refinanced my loans, I got a crazy low rate plus a cash bonus. And all that extra money helped me finally buy my own car.
Where are we going?
Anywhere we want.
Laurel Road for Doctors. Banking, insights, and benefits uniquely designed for doctors. See laurelroad.com/doctorchecking for full terms and conditions. Laurel Road is a brand of KeyBank N.A. member FDIC.
Dr. Steve Kupferman, thanks so much for being on the podcast.
Thank you. I've been waiting for this for a long time.
Okay, so we're going to be talking about virtual assistants today. And so let's start off with, what is a virtual assistant?
So a virtual assistant essentially is a employee who works from home. Generally, as a virtual assistant, we're typically talking about somebody who's working from another country. So when it has to do with healthcare, these are usually healthcare professionals in the Philippines or South America who are working from home, doing the typical tasks that are done in a medical or dental or veterinary office, but they're doing them remotely, usually, at nighttime for them. And all the things that are typically done in the office that we now understand could be done remotely, that's what a virtual assistant is.
Okay, because at the beginning of the definition, it's anyone who works from home. That's like half of America right now. So, and going forward, probably still a significant portion. So what you're saying is it's an employee who's really mostly unable to ever arrive at the site of work. Their job is in its entirety done remotely, and usually they're not in the United States.
That's correct.
Is that always the case that they're foreign nationals, or at least in another country, or are we seeing some work done here domestically, but just completely remotely?
I think the term virtual assistant really refers to somebody who's working from another country, rather than somebody who's, the typical remote employee that we know of today. Because this all started before people really, took on to remote employees. That, occurred mostly during the pandemic. People started realizing that so much can be done and so much can be accomplished productively from home. So virtual assistants started before that, before people really understood that concept.
Now, why would someone hire a virtual assistant? What are the advantages there?
Oh, so many. So, the easiest way to really think about it from a healthcare provider's perspective is a virtual assistant can basically do any of the tasks that are done in an office. Easiest to understand would be billing and collections, authorizations, and things like that. those are really the easiest things that can be done by a virtual assistant, because for the most part, they're calling people who work for payers that are outside of the country as well. So, doctors had this difficulty in that payers had an unfair advantage of being able to hire outside of the country using their own virtual assistants. Many of these companies have large offices in the Philippines and other parts of the world where their workforce is working remotely. This has been around for a long time. And so the easiest way that doctors and healthcare providers can utilize virtual assistants would be in communications with payers, insurance companies.
Yeah, it sounded like, right, you've mentioned a couple times the Philippines, which makes me think, well, they're on the other side of the globe. They're in a completely different time zone. And so if they're having to get authorizations from insurance companies, they're going to be calling, like they're awake in the middle of the night for us. So how are they calling Aetna in the middle of the night and getting anything accomplished? But it sounds like what you're saying is, well, the person that they're calling is often also not in our time zone, not in our side of the globe. And so it actually works out maybe even better.
Well, the reality is those people are all working the graveyard shift. They're working U.S. hours in the Philippines. So, and that's how almost all of our virtual assistants are functioning. They are younger healthcare providers or healthcare staff that were physical therapists, pharmacists, pharmacy technicians, nurses, medical assistants, who are very comfortable working the graveyard shift. They're younger. They may have young kids. They're happy to do a night shift, and maybe their husband or wife is working the day shift. And when they finish their night shift, their kids are waking up from a night of sleep and getting ready to go to school. And then while the kids are in school, they're taking their sleep, just like, a lot of, hospitalists are working here in the U.S. They're doing night shifts. Some people only do the night shifts. So that's how it's working in the Philippines. A lot of these virtual assistants are, younger, former nurses, and they're just working the night shift.
And so, we were talking about the advantages. Is it cost? That's the primary advantage there, is since there's a lower cost of living in those countries where, the salary that you'd pay one is significantly lower. So there's cost savings.
I knew you asked me a question that I totally forgot as I was answering.
It happens. It happens to me too.
Yes, the advantage. So there's obviously a cost advantage. We're taking advantage of the leverage of the U.S. dollar. So there's a tremendous advantage there. But I think it's more so, particularly in larger cities like you practice in New York, I practice in Los Angeles. Real estate is very expensive. Parking is very expensive. Employment law is very expensive. Insurances are very expensive. These are what make up all the large comp packages for each and every one of our employees. And the hourly rate is just a small part of it. So there's tremendous advantages from a financial standpoint. There's tremendous advantages in cities like New York, in states like New York and California, where you have a lot of liability when you have employees. Tremendous liability. So there's huge liability advantages in using remote employees or virtual assistants. But probably the biggest advantage post-pandemic or intra-pandemic, wherever we are right now, is really the workforce. We can easily get people from the Philippines to work and retain them for long periods of time. Compared to what we can find here in the U.S. right now. The workforce that made up the typical person working in the doctor's office seems to have disappeared and moved up the ladder, so to speak. And so they're just so hard to find right now. And we don't have that if we're using virtual assistants to do a lot of those tasks.
So one of the reasons that in our industry it's hard to find people and hard to keep people is some of their job really just sucks, right? Like, you're getting yelled at by patients that are made to wait. You're getting yelled at by patients that didn't realize they had a high deductible, and so now they're getting a bill. Like, you're often dealing with disgruntled people. And a lot of times their hands are tied, right? They don't have a lot of autonomy to be able to solve those problems. So actually, one of the things that I'm doing with my practice is I have this, it's called the Patient Experience Committee, that ultimately it's the Staff Experience Committee because staff experience is patient experience. And so we're trying to find ways to provide them with more autonomy, make their jobs more fulfilling, make it so that it's a place where they really want to work. But when you have a virtual employee, they're so disconnected from, the work at the office, from patients getting healed, patients doing better, patients, right? How do you make sure that their work is fulfilling?
So it's a good question, and that's one of the reasons why the Philippines is such an advantageous location to find virtual assistants. The country there, we have an industry here, let's say in LA, that's very focused on Hollywood, and there it's very healthcare focused and very customer service focused, and customer service, which is kind of what you're talking about, the patient experience. We struggle with that here in the U.S. There's some great examples that have thrived in that. Looking at, say, some great hotel chains and other customer service industries in the U.S. But in the healthcare sector, we've struggled with that for a long time, and the culture in the Philippines is somewhat different than we're used to. They're very customer service oriented. They will do almost anything to make somebody happy. And then in terms of sort of retaining them and keeping them and making them feel as though their work is rewarding, it's much easier because they're working for for people in the United States. There's tremendous respect for the United States and the Philippines, and so it comes along with the territory when you have younger healthcare professionals who see the opportunity to work for a U.S. company to get paid better than they would, say, in the Philippines. There's a tremendous responsibility that they're taking on, and they feel really really rewarded by it.
All right, so it sounds like a lot of them are coming from the healthcare field to begin with, and so now they are taking on work in the United States where they're. It sounds like there's some mentorship there, right? They're learning from our system, they're learning from the physicians that they're working for, and so the fulfillment comes from the learning experience and the mentorship. So that seems like a good way to make sure that they stick around, that they want to continue working for you, so to really foster that relationship.
There's so many, so many other reasons. You think traffic on the LIE is bad, go to Manila for a day, take a look what traffic is there. And, if you're going to a hospital that's, 10 miles away, it can take you 3 hours to get there. So, this is a very appealing job. They get paid in American dollars. So, if you go to another country and you start spending American dollars, you realize, wow, this goes a long way. The same thing is true, for them. So we're definitely able to pay them a lot more than they can get paid working in, say, a skilled nursing facility or a nursing home or hospital. So it's very rewarding, and the retention rate is very high.
So what about hiring for, it sounds like you use them in your clinical practice, right? But a lot of the listeners, a lot of physicians out there, they have side gigs, right? Everyone's got their side hustle. You got your main hustle, you got your side hustle. And so if you're looking for a virtual assistant to help you with your side hustle versus your clinical practice, is there, where do you look? Is there a difference, or you're really going to the same place, whether you're using them for something clinical or non-clinical, or main gig or side gig?
Yeah, you're going to the same place, and you can use them for your side gig. Certainly, you can use them. One of my big beliefs is that because burnout is so high in healthcare right now, that having somebody for a side gig or just a side kick to just be there to help manage life there, I think there's really tremendous advantage in having somebody who can do that for you. So I think this is an answer to burnout. I think, it's the same person. You can have, any virtual assistant that you feel you're, comfortable with. They can help you with your side gig. They can help you with your clinical practice, whatever it is you want. They're available to help.
So where are you going to find one? So Fiverr, when I was trying to build a website, when I was trying to promote my podcast more, places that would look were Fiverr, Upwork. There's this place called Bark for social media, Freelancer. So where am I going to find a virtual assistant?
Well, I'm very biased because I run a virtual assistant company.
Come on, this is a layup. This is an alley-oop for you.
Yeah, I mean, we have people who do, anything from bookkeeping to social media to, just managing your day-to-day life, to people who will, do any of the regular jobs in an office, authorizations, insurance claims, marketing, whatever it may be. So, we sort of pride ourselves on being, a healthcare company or a healthcare tech company where, we're able to provide people that have some healthcare background, but they're very technically savvy. So we put them through training. We do tremendous due diligence. They're all HIPAA certified. And so, we feel that the people that we're training are people who are there to help doctors, whether it's to help them in their clinical practice, to help them manage their regular daily life, which doctors seem to forget about most of the time.
Your virtual assistant calls, take your vitamins.
Exactly.
Take your medication.
Order me lunch.
Yeah.
And then of course.
Wait, really? That's a thing? People do that?
Yeah, you just give them your Uber Eats or DoorDash account and you'll get lunch to your office every day without having to eat garbage or donuts that your local doctor friend sends over.
Wow. Okay. I mean, I didn't realize.
Yeah. I mean,
that's
why
something
not?
that you would delegate to someone else unless you were one of you were just attending the Oscars or something.
Yeah. I mean, you just have to sort of think about because technology has really changed so much, and there's so much that you can get done. I mean, you can do so much as a doctor, but you're just limited by workforce and your time. And if you had, obviously we don't have enough time. None of us do. And we can't afford that much workforce because there's just a limit to how much you can produce as a doctor. And so this allows this allows so much of that to be possible. So
I can see 5 more patients a week if I don't order my own lunch. Huh. Let's try and squeeze blood from a stone here. Yeah.
Or you can actually eat lunch, 5 days a week.
So let's say you're open to the idea, but you're uneasy about delegating to someone that you've never met in person before. Although there's a lot of evidence out there that when you do interview someone and meet someone in person, you often judge them by the wrong characteristics and you don't end up hiring them for the right reasons. So the fact that you're not meeting someone in person, it actually does take some of the bias away that would end up misleading you. So, but nonetheless, there is this comfort to having met someone in person and interviewed them in person, and as opposed to someone who's a million miles away. So if you're just starting to delegate, what would you recommend as some of the early tasks to get the physician comfortable with delegating to a virtual assistant?
So the easiest thing to do with a virtual assistant, if you're working in or running a doctor's office, is whatever requires you to contact an insurance company, whether that's by paper or by phone. That is the easiest way to get started with a virtual assistant. And there, in any doctor's office, that work is endless. And so if you're trying to start,
so anything that requires you to wait on hold for hours on end.
Bingo.
Okay.
So that's the first place to start with a virtual assistant. Or if you're more of an academic doctor, I'm sure you have tons of research ideas that you have collected data on, or you have data in your EMR on, you can put a virtual assistant on that. Some people are more motivated by those sorts of things rather than the claim adjudication. So if you have a research project that you've been thinking of for, I don't know, the last 20 years, and you just don't have the money to get it done or the staff or whatever, you hire a nurse from the Philippines who will do it all in very quickly. So any data entry or anything like that, these are really easy, simple ways that anybody can take to start with a virtual assistant. Yeah, those are the easiest ways to start for sure. And there's no doctor that doesn't need at least one of those things. You can, and then of course there's so much more you can expand on. I was telling you earlier about the DoorDash. You probably you're an otolaryngologist. You probably have a bunch of doctors that are sending you patients, and you want to make sure that they know that you're available and that they have your cards available there, and that the front office is getting cookies or whatever. So I have a virtual assistant who has a DoorDash account who calls offices that we work with all the time, make sure everything's going okay, and ask if there's any issues, communication issues. Do you need more cards or referral cards? And send them some cookies or whatever it is. We do that every day.
So when you're interviewing, what are the qualities that you look for? How do you vet a virtual assistant in an interview?
That's a good question for somebody who's going to try to do this on their own, because you go on some of these other sites where they're not really vetted. It's just a place for people to sort of hang out and be ready to be hired. So all of our virtual assistants at MedVA are trained and screened. But you'll have an opportunity to get 3 or 4 different people, and you'll interview them in a very similar manner to the interview we're having right now, which I think everybody is now comfortable with, even though there is something to say about meeting somebody in person. But it'll be an interview, such as this, where you're just talking, and then you develop a feel for whether you feel that person, is the one that you want to do whatever tasks you're thinking of having them do. You're going to listen to them talk. You're going to ask them, what they do for fun, and whatever questions you typically ask on an interview. I've done, so many of them in person, and of course now I've done so many of them, quote, virtually or on Zoom. And I think anybody who's even hiring people to work in their office these days is doing them on Zoom, because no one's coming for interviews anymore. They're either not going to show for the interview that they schedule for, or you won't be able to get them to come directly to your office anyway. So those are when you're hiring somebody, you have to have a feel for it. If you've never done it before, it's very hard to really, get a feel for what you're looking for. But, it sounds like you've done a lot of them. I've done, a ton, and you just start to get a feel for the kind of person they are, and, what makes them tick, and whether they're the kind of person that you want working for you.
Do you end up building a team that's remote? So like they end up working together and they're in a similar location. So you've got like a remote team that ends up working together, or each member of your virtual team is in a distinct location and they ultimately don't interact with each other that much.
Correct.
Or they interact with each other only virtually, so it doesn't really matter because it's all virtual anyway.
Yeah, so they're all working remotely, individually, from either their study or closet or whatever they have their setup for their home office. So that's how each and every one of our virtual assistants are working, and then they use all of the easy, accessible, HIPAA compliant technologies to communicate. So they'll use a voice over IP phone system. They'll use our Microsoft email servers that you have in your office, or if you're using Google or whatever you're using for your email. And then they'll use a HIPAA compliant chatting version, whether it's Teams enterprise version, or whether it's Google Chat, the enterprise version, or Slack. There's just so many that you can use to communicate. So it doesn't matter where they are. We've all kind of learned that already.
Are there any legal issues you've encountered with hiring someone remotely with regards to like the healthcare system, not with regards to them being an employee? Because I think that's a little beyond the scope of this interview, but just just the healthcare aspects, or because they're not practicing medicine, it doesn't matter. It's not like they need a domestic medical license.
Yeah, it's the same as any employee that you have in your office. You can't give say a high school graduate front office person the ability to do things that are beyond what is allowed by your licensure in your individual state. So you have to have the same sort of compliance that you would have in your office. There are some virtual assistants who have USRN licenses, so they're allowed to do more. They're just working remotely. We have some that are that have taken their NCLEX and they're licensed U.S. nurses. They just chose to stay where their family is in the Philippines, and they just they want to stay there. So you have to, just like in any office, you have to be sure of what your employees are doing, and you're ultimately responsible for what they do. So of course, there are legal implications of that, and you just have to train your employees in the same way that you would if they're actually sitting in your office.
Any parting words for our physician audience? Any topics that we haven't touched on, or has this been my usual comprehensive, all-encompassing interview?
No, I mean, I think that, this is certainly something that a lot of people have already sort of, thought about and are beginning to realize that certainly in the private practice of medicine, the ability to find talent, to retain talent, to afford talent is becoming more and more scarce. We feel that this is a solution. We feel it's a great solution. We feel the talent is really spectacular. And we think that it's going to catch on, and I think it'll be the future of the private practice of medicine, and most likely larger medical organizations that are going to find it harder and harder to find employees and afford employees are going to start to follow suit.
Yeah, they'll probably end up building like large hubs in some other countries where where the employees aren't working virtually. They actually have to go to work because they have like an information technology center where they have to go to. So it's a benefit to us. There are a lot of places are doing that now. That's where their call center is. Anytime I have a problem with Chase, it's not answered domestically. So it's already happening.
I went to the Philippines when I was starting to look into this, and that's why I realized, wow, this is the future, because so many American companies have these call center hubs there, and it just seemed to me like it was really the future for healthcare. So yeah, I think it truly is.
So where can people find MedVA, and where can people find you online?
medva.com. That's where we can
Easy
find
enough.
us. medva.com. That's where we'll be. That's where we are, and that's where you can easily contact us and ask for some resumes of our trained staff who will work for you and do what's needed to maintain the workforce in your office.
There's no MedVA Twitter and TikTok account or Instagram that we should be following or just medva.com.
Well, there are. I'm not the social media guru, but we definitely have an Instagram page or whatever it's called. We definitely have.
Okay, we'll be sure to follow you.
We definitely have a Facebook page and all that. So yes, we'd love for you to follow us. For those who are looking to be followers. Yeah,
I'm sure you can find it all through the site that you told us, medva.com. Great. Exactly. Fantastic. Well, yeah, I agree. I think this is where we're all taking our side gigs, and it's time we also take our main gigs in that direction as well. So you've certainly provided a platform to make it easier for us, and thank you, and thanks for your time.
Great. Well, thank you.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. He can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, please be sure to leave a 5-star review on your preferred podcast platform. We'll see you next time on the Physician's Guide to Doctoring.